Hello, my name is Victoria Reed, and I'm going to share my presentation of my capstone project for this semester. My project is going to focus on youth substance abuse in Caldwell County, North Carolina. I'm going to walk through the background of the issue, research findings, my intervention model, stakeholders, implementation strategy, evaluation plan, and how this connects to my professional goals in healthcare. I'm going to go over the background and significance of my project. Caldwell County youth demonstrates elevated use of vaping devices, alcohol, and prescription drugs compared to state averages. So within Caldwell County, it is a little bit higher than some of the other areas in North Carolina. Research clearly shows that exposure before the age of 15 specifically, that this gives a drastic increase to the likelihood of addiction going into adulthood. Rural areas like Caldwell County, they face additional barriers compared to larger cities and places that are going to have more resources and funding to be able to give the people the resources that they do need to get help. So this demonstrates the need for early, preventative, and community level solutions. Um, And then local data snapshot. So local and regional data show a concerning pattern. Vaping continues to rise. Opioid misuse risk are increasing. And then alcohol remains the most commonly used substance among the youth in North Carolina. So when you have these numbers that are trending upwards and they're not really, improving, not seeing much change in the data, it is going to negatively affect a lot of areas of the youth's life. So it's going to affect a teen's mental health. It could affect their performance and then any future health outcomes. So when the youth are using these substances as their brains are developing and growing, that is such an important and vital age that they are getting everything in their body that they need. And when they're using these harmful substances, that can stunt their growth, that can cause issues within their mental health. Also, as well, if they are using substances, this can boil over into their school performance and how they're showing up at school. They're not able to show up as their best self when they may be using substances that can alter a lot of things in their life. Also, with any substance use, this can affect any future health outcomes for the youth, especially like I said, mentioned earlier, that their brains are still developing, they're still growing, and they really just need all of the healthy nutrients and things going into their body. So this can definitely affect any future health outcomes for the youth. So this project focuses on prevention at the age when behavioral patterns are still being shaped. It's very important that we just become that strong foundation for the youth. That way that they know, have the resources that they need, have the decision-making skills that they need if they are prompted into a situation that may be detrimental or may be a life-altering decision that they make that, they make a decision to use a substance and then they go through that in their adulthood. It's a very pivotal moment for the youth in this age. Going over the literature review. So, literature consistently reinforces three important ideas. First, prevention must happen early. It is so, so important. And that may be one of the most important things through this whole topic is that we are preventing substances from even happening with the youth. It's going to be a lot harder to once a teen is trying substances or in the habit of trying substances, to stop that. Um, because it can easily become a habit and something that they do, and it will just be a lot harder to stop it once started. If we can get to the youth and let them know, the consequences, the outcomes of some of these things and can happen if you do consume substances, I think it's a lot easier to steer them away from that. Second, is that school-based interventions, they significantly improve student knowledge and refusal skills. So the youth, they spend a lot of time at school. Um, so during this time, having the school-based interventions, they can increase a student's knowledge on substances, what they can do to the body, the mind, physically, mentally, the outcomes that can happen with trouble, with your physical health, and then giving the students refusal skills to know what to do when they're in a situation where they may be in a situation of peer pressure. They know what to do and how to cope with those situations and make a better positive decision instead of trying to partake in those substances. Third, community collaboration ensures long-term sustainability. It's very important that we are coming at this at a multifaceted perspective with the community. Um, you want to be able to have the community to back you up in that could be in resources, that could be in funding. It's really hard to have a program like this and not have any kind of funding behind it or resources because you have to have the people who are able to teach the teens the information. So you have to be able to train and give these parents and teachers, educators the information that they are needing. So these findings shape the development of CRYPI as a multi-level intervention involving schools, families, and larger communities. Like I said, it is very important that you come at this at a multifaceted approach because you can't just tell a student, hey, don't do a substance. You have to involve the school. They are there a lot through the day, and it's a big influence when they are at school. You want to get the parents and the families on board of these students. That way that they can try to help them outside of school when they are making decisions in their daily life. And then you want the larger community to be there to back them up and support them, to give them the resources and, possibly the funding that is needed for something like this to be successful. So defined problem and SMART goals. These SMART goals are measurable, realistic, and they're aligned with local needs. The focus is on improving knowledge. That's very important. You want the teen to be able to understand what happens, the consequences that can be given if they do partake in substances. You want to expand prevention training. That's very important. You want these educators and teachers who are given the information to the teens to be very competent in knowing what they are giving them. And then reducing stigma. There's nothing wrong with having a substance abuse problem or wanting help from that. You want to make your program be a safe haven for these teens who may be in these situations. And combining all three of these, creates a more supportive environment for the youth who may be at risk or are already struggling. CRYPI, it operates on multiple levels, consistent with the social ecological model. Um, so this is focusing on the student, the family, the school, and the broader community. Like I said, you want to come at this at a multifaceted approach that is going to give you the most success in improving numbers, improving statistics, and hopefully, you know, reducing the numbers in the students that are using substances. So the SMART goals for hours is going to be to reduce self-reported prescription and alcohol misuse among the Caldwell County High School students by 15% within 14 months through community initiatives and school education. You also want to increase participation in local youth mentorship and prevention programs by 20% within 1 year, with targeted to underserved and rural areas. Um, and then improve parental awareness and community of prevention strategies and warning signs by 40% within 8 months, measured through pre and post intervention survey data. So, those are some of our SMART goals that we want to try to achieve with our prevention program. And then intervention. So, students gain key skills. Parents reinforce them, and educators deliver curriculum, and coalitions can help with the training and then sustainability. So it's very important, like we mentioned, that students gain their skills. They want a good, strong foundation of ways to overcome, ways to get through, and ways to have positive outcomes. You want them to know if they are up against a peer pressure situation or they go home and they're around substances that they know that it's not a good thing to do and what it could do to the body and what the outcomes could be. You want them to have those skills, very strong skills. Um, and then you want the parents reinforcing this. Um, you want the parents to help the students in making good decisions, to back them up when they may need support or help or are struggling. You want the parents to be there behind them and to guide them on what would be next if they do need help. And then you have your educators who deliver the curriculum to these teens. They need a lot of training and making sure that they are competent in giving the information, making sure that they understand what is needed to have a successful prevention program. I think that is very important. And then you want to have coalitions help with training and sustainability. So the coalitions can help with the funding, with getting the right resources for training for the educators, and just delivering that and making sure that everyone is competent in what is needed. So the intervention model, school workshops could help with coping and stress management, refusal strategies that may be needed, and skill building. Family engagement could be to have the resource guides, if the student is struggling, that they know where to go. Parent workshops that they could get more information and how to, help their teen that may be struggling or is thinking about substances. And then having the take home learning that they can also follow through with. Community collaboration could be prevention events, everyone coming together and going to these events, and then awareness campaigns, just to have that for everyone in the community. So the targets is going to be individual, relationship, school, and community levels. So everyone wants to be involved. This will make the prevention program a lot more successful. And then stakeholders and roles. Let's see. Evaluation occurs throughout. So we'll go through stakeholders and roles first. So the student's role is going to be to participate in your peer leadership and prevention sessions. So they are going to be the ones who take in the information and what is given. Caregivers and parents are going to, like I said, reinforce prevention at home and attend workshops to help them become more knowledgeable and have the resources needed if they have a teen struggling. Staff and educators are going to support students and deliver the curriculum. They are going to be trained and competent to give that student the information needed. Community organizations are going to provide those resources and the funding. Public health department is going to provide trainings, and evaluation assistance. And then coalitions such as Caldwell County Schools and the health department are going to provide that coordination and sustainability. So some of the implementation phases that I have come up with, phase one would be action would be partnerships, curriculum planning. That would take around 2 months. Phase two is getting the parents on board with the training that's needed and then staff and mentor training as well. This will take around 1 to 2 months. Phase three is peer-led initiatives begin, student workshops. This would be throughout the full school year. Phase four is a community events and awareness campaigns. This is kind of an ongoing thing that, we would come back to. And then phase five is evaluation, focus groups, data analysis, and surveys as at the end of the year just to see the progress that is being made. Hopefully, we have made some really good progress in this time because that means that we would have a successful prevention program in place. And that is our main goal and what we want to see. So first we build the partners in the curriculum, then we train the staff, and then followed by student program and wider community engagement. And then evaluation occurs throughout, but the final review is conducted at the end of the academic cycle. Like I said, we would do, evaluations throughout the program just to kind of get an eye and see how things are going. And then if we needed to change anything or, you know, um, just maybe change things around to see if we can get the numbers up, we would do that. And then at the end, we would have our final review to see how the program was going. So, mitigation and strategies include normalizing conversation about substance use, conducting paper-based assessments, and scheduling educator trainings when they do not interrupt construction time. So you would want to normalize conversation about substance use so they are not feeling that stigma around it, that they feel comfortable and safe and have someone to talk to about if they are struggling or if they are thinking about substances. You want to do paper-based assessments. That way you can see it on paper and conduct that information and see what needs to be done, see if things are going well in the program. And then you want to do the educator trainings. You always, quarterly or whichever time that you wanted. I feel like educators need to be continuously trained because things change throughout and they need to be competent on what needs to be done and what we need to do to be successful in our program. So the pre and post surveys will be done, focus groups, and then engagement tracking, educator competency measures. So we would do those just to see how things are going along in the program, making sure things are going up on the scale and not down. Just to make sure if we need to make any changes. Long-term success depends not only on student knowledge, but I think it really depends on the willingness of the student to want to get the community help and the resources that are there. So I think really just having a strong, plan and trying to really reach out to these students is very important. You want to make sure all of the educators are competent and the parents are on board and competent as well, because the program would be nothing if the student does not want the help. Um, So this project has helped me better understand just the reality of prevention work within rural communities. It's a lot more important that you fight for these programs because, like I said, we are very lack and we do not have as many resources as a lot of the bigger cities. It's a lot easier for some of those to get the help that's needed. So it is very important to focus on these rural areas that need it. And they are a lot going without and not having the resources that they do need. Um, and then it showed me the value of early intervention and collaboration across systems. I think early intervention is very important through a lot of things, not just this issue. And it aligns closely with my professional goals in healthcare, where education and prevention are critical.